Welcome to Fundamentals of Health Informatics, a course comprehensively designed to explore core components of digital health systems that are transforming modern medicine and healthcare administration. This field sits at the crossroad of healthcare and information technology, playing a critical role in enhancing healthcare delivery, optimizing processes, and improving patient outcomes. Throughout this course, you will gain a foundational understanding and appreciation of how health informatics integrates into various healthcare practices, significantly transforming the industry. Health informatics is reshaping how patient care is delivered and optimized, how information is stored and shared, and how healthcare systems can operate more efficiently and effectively. As digital transformation continues to penetrate every aspect of healthcare, understanding health informatics is essential for clinicians, administrators, IT specialists, and policy makers alike who seek to harness technology to improve patient outcomes and streamline healthcare delivery. As healthcare systems around the globe evolve to meet the demands of modern patients and practitioners, health informatics emerges as an essential field. This course aims to equip you with a comprehensive understanding of how digital tools streamline operations, enhance decision making, and ultimately improve patient outcomes. With health informatics being central to innovation in patient care, administrative efficiency, and research. Mastering its components is crucial for any healthcare professional, IT expert, or policymaker. As the digital transformation of medicine accelerates, the importance of harnessing information technology to provide health at community, national, and global levels has become evident, and understanding the ethical and legal frameworks surrounding health data becomes increasingly important. This course aims to equip students, healthcare practitioners, administrators, and technology professionals with a solid understanding of core concepts, tools, and challenges involved in health informatics, with a particular focus on how technology supports and enhances clinical decision making processes. Also, with foundational knowledge on how to ethically and legally manage health information, ensuring that technological advancements serve the best interests of patients and society at large. We will review each of the modules and subtopics covered in this course. Module 1, Introduction to Health Informatics. Beginning with the essentials, this module introduces the definition and significance of health informatics. As a multidisciplinary field, health informatics brings together computer science, information science, and healthcare to manage and process healthcare data, ensuring its efficient use for clinical and administrative decision making. Firstly, definition and significance of health informatics. Health informatics is defined as the acquisition, storage, retrieval, and use of healthcare information to foster better collaboration among patients' various healthcare providers. Its significance cannot be overstated as it acts as a foundational pillar in achieving efficient, effective, and economical healthcare delivery. By improving data management and access, health informatics enhances the quality of patient care, supports healthcare efficiency, and empowers patients. Historical developments and milestones. Understanding the historical context of health informatics is crucial for appreciating its current landscape and future potential. From the earliest computerized health systems in the 1960s for billing and appointment scheduling to today's sophisticated integrated care platforms, each milestone has pushed the capabilities of healthcare forward. Noteworthy movements include commercialization of hospital information systems in 1970s and the rise of electronic health records in 1990s. Today, new horizons are being explored with advanced analytics, telehealth, and artificial intelligence, continuing to shape the field. Core concepts and terminologies. This course will equip you with the key concepts and terminologies essential for navigating health informatics, such as interoperability, data mining, clinical decision support. Understanding these terms is integral to grasping the scope of complexity of health informatics and applications in healthcare settings. Central to this module is the introduction to health information exchange, data standards, and the role of informatics in facilitating seamless information flow across different healthcare platforms. Roles of health informatics professionals. Health informatics professionals sit at the intersection of healthcare delivery and IT, encompassing various roles including health informaticians, clinical informatics specialists, and health IT analysts. Their expertise in system analysis, data management, and application development is critical for advancing health informatics objectives. This module explores those roles in depth, highlighting the need for multidisciplinary collaboration and critical thinking necessary to adapt to and implement evolving technologies and protocols. Next, Module 2, Healthcare Systems and Processes. This module provides a comprehensive look at healthcare systems and the processes within which health informatics operates. It emphasizes the integration of information systems within clinical and administrative environments to improve healthcare delivery. Overview of healthcare delivery models. Students will explore different healthcare delivery models from around the world, including public, private, and hybrid systems. The focus will be on how these models accommodate and benefit from health informatics solutions, particularly in terms of efficiency, cost effectiveness, and patient centered care. The module will highlight comparative analysis of various national systems, examining how informatics strategies contribute to their success or challenges. Next, clinical and administrative workflows. Healthcare environments thrive on complex workflows. This module introduces the dynamics of both clinical and administrative processes and the role of informatics in optimizing these workflows. By automating and streamlining tasks, health information systems can reduce bottlenecks, minimize errors, and improve service delivery timelines, which are essential for effective patient care and resource utilization. Next, impact of informatics on healthcare operations. Informatics is a transformative force in healthcare operations. This section examines how informatics facilitates improved diagnostics, accuracy, enhancing patient safety, and supports management decision making processes. Real world cases study will illustrate how informatics has led to operational improvements, touching upon successes in reducing patient waiting times, improving resource management, and enhancing patient satisfaction. Next, interoperability between systems. This module explores the technical and strategic aspects of interoperability, a cornerstone of modern health informatics. With electronic systems now prevalent throughout healthcare, ensuring these systems effectively communicate is essential for cohesive care delivery. We delve into standards, protocols, and strategies for achieving interoperability, essential for facilitating health information exchange across diverse healthcare settings. Next, Module 3, Health Data and Standards. The heart of health informatics lies in the efficient management of healthcare data. This module delves into the types of data prevalent in healthcare, the standards that guide their use, and the critical importance of maintaining data privacy and regulatory compliance in the medical arena. Types of healthcare data, structured and unstructured. Healthcare data is diverse and complex, comprising both structured and unstructured forms. Structured data refers to information that is highly organized and easily searchable in databases, such as lab results, billing codes, and patient demographics. This data is crucial because it can be efficiently processed by algorithms and systems to support clinical decisions and operational workflows. On the other hand, unstructured data includes narrative text like physician notes, diagnostic imaging, and free text fields that contain rich clinical details but require advanced tools like natural language processing, also referred to as NLP, for extraction and analysis. Understanding the interplay between these data types is essential for providing a holistic view of patients' health and enabling comprehensive data integration across systems. Next, data standards and protocols, HL7, FHIR, interoperability, the seamless exchange of information across disparate systems is a central tenet of effective health informatics. To facilitate this, data standards and protocols such as HL7 and FHIR are employed. HL7 provides a framework for exchanging, integrating, and retrieving electronic health information, widely used for clinical messaging. FHIR, a new standard leveraging web technologies to simplify data exchange, making it conducive to mobile applications and cloud based systems. These protocols ensure data consistency and facilitate communication between various software applications, supporting integrated care delivery and better patient outcomes. HL7 is referred to as Health Level 7, and FHIR is referred to as Fast Healthcare Interoperability Resources. Next, ensuring data privacy and security. With the increasing digitalization of health data comes the paramount responsibility of ensuring its privacy and security. Healthcare information is highly sensitive, and unauthorized access can have serious implications for patients' confidentiality and trust. This section explores various methods employed to safeguard data, including encryption, anonymization, and access controls. You'll learn about the importance of building secure systems that protect against breaches and comply with standards, fostering trust among patients and stakeholders in the digital health ecosystem. Next, regulatory compliance, such as HIPAA and GDPR. Navigating the complex landscape of regulatory requirements is essential for any professional working with health data. This part of module covers key regulations, including HIPAA, also referred to as Health Information Portability and Accountability Act in the United States, and GDPR, also referred to as General Data Protection Regulation in the European Union. These laws establish guidelines for the protection and confidential handling of personal health information. By understanding these frameworks, students will be better equipped to design and maintain compliant healthcare systems, minimizing liability and ensuring that data sharing practices meet legal and ethical standards. Next, Module 4, Electronic Health Records, also referred to as EHRs. It focuses on one of the pivotal components of health informatics, that is, electronic health records. EHRs are at the core of healthcare IT, enabling seamless access and sharing of patient information across multiple platforms and stakeholders within the healthcare ecosystem. Components and architecture of EHR systems. At the heart of effective healthcare delivery systems today lies the electronic health record system. EHR serves as digital repositories of patient health information, capturing a range of data points from medical histories to treatment plans. The architecture of EHR is designed to provide comprehensive data collection, integration, and utilization. Key components of EHR systems include modules for patient demographics, laboratory and imaging results, clinical notes, medication lists, and billing information. These components are interconnected through a sophisticated software architecture that supports data interoperability, real time access, and secure transmission. Understanding the structure and components of EHR systems is crucial for appreciating how they function as a centralized hub for all patient related information. This module explores the technical underpinning of EHR systems, discussing how they integrate with other health information technologies such as practice management systems and health information exchange, also referred to as HIEs. By familiarizing yourself with EHR architecture, you'll gain insights into how these systems facilitate effective communication between healthcare providers, boost care coordination, and improve patient safety. Next, implementation strategies and challenges. Implementing an EHR system within a healthcare setting involves intricate planning, execution, and ongoing management. Successful implementation hinges on a variety of factors, including precise system selection, thorough needs assessment, and comprehensive stakeholder engagement. A valuable aspect of this module is learning to develop and execute strategies for EHR deployment from initial planning phases through to evaluation and optimization. However, implementing EHR systems is not without challenges. Common obstacles include high costs, disruption of existing workflows, resistance from staff due to changes in routine, technical issues such as software glitches, and ensuring system interoperability. Additionally, HR implementations often reveal significant demands for training and support, requiring healthcare organizations to rethink how they manage change and technology adoption. By understanding these challenges and strategies to overcome them, you will be equipped to guide your organization through complexities of EHR adoption while maximizing the potential benefits. Next, benefits of electronic records. Electronic health records offers numerous benefits that extend across the healthcare spectrum. impacting patients, providers, and administrators. For patients, EHRs enhance the quality and continuity of care by providing comprehensive health information that follows them through different care settings. This accessibility reduces the need for redundant tests, minimizes the risks of errors, and supports personalized treatment plans. For healthcare providers, EHRs improve efficiency by streamlining workflows, reducing paperwork, and providing quick access to critical patient information. They also support clinical decision making by integrating evidence based tools which can help improve diagnostic accuracy, suggest treatment options, and flag potential adverse interactions. On an operational level, EHRs facilitate billing and administrative processes, enhance resource management, and support compliance with regulatory requirements. By aggregating vast amounts of data, they also contribute to actionable insights and strategic planning through robust reporting and analytics capabilities. Understanding these benefits empower you as a healthcare professional to recognize the full value of EHR solutions and advocate effectively for their implementation and optimization. Legal and ethical considerations in EHR use. The widespread use of electronic health records introduces a host of legal and ethical considerations. One of the paramount concerns is ensuring the privacy and security of patient information. With increased digital access and sharing of data, it becomes crucial to understand laws and regulations governing data protection, like the Health Insurance Portability and Accountability Act, also referred to as HIPAA in the US, and the General Data Protection Regulations, also referred to as GDPR in Europe. These frameworks establish stringent guidelines for how patient information should be handled, stored, and shared, placing considerable emphasis on consent, confidentiality, and the right to access information. Ethically, professionals must navigate the challenges of data integrity, patient consent, and potential for information misuse. This module explores how EHR systems can be implemented in compliance with these regulations while addressing ethical challenges involved. As technology continues to evolve, staying informed and responsive to these issues is vital for maintaining the trust between patients and healthcare providers and for upholding the standards of modern healthcare practice. Next, Module 5, Clinical Decision Support Systems, also referred to as CDSS. As systems around the world evolve towards digital solutions, health informatics has become essential for improving patient safety, enhancing clinical outcomes, and streamlining healthcare operations. A central element of this field is clinical decision support systems, also referred to as CDSS, which are revolutionizing tools designed to assist clinicians at critical moments in patient care. This module starts by emphasizing the purpose and types of CDSS, exploring how these systems are tailored to meet diverse clinical needs. The primary aim of CDSS is to improve safety, accuracy, adherence to best practices, and overall care quality by providing timely, evidence based recommendations, alerts, and reminders. These systems vary from simple rule based alerts, warnings against medication interactions or allergies, to sophisticated machine learning driven tools capable of predicting patient risks and supported complex diagnostic and treatment decisions. Understanding the different types of CDSS is fundamental to appreciating their versatility and potential to impact various clinical scenarios. The effective integration into clinical practice represents a crucial aspect of maximizing the benefits of CDSS. Embedding decision support into already busy clinical workflows requires careful planning to ensure that alerts are relevant, non intrusive, and seamlessly incorporated within electronic health record system. Proper integration strategies involve customizing alerts to avoid fatigue, align decision support with clinical routines, and providing proper training to healthcare providers. When integrated successfully, CDSS becomes natural extensions of clinicians' decision-making processes, providing support exactly when needed, whether during prescribing, diagnosis, or care planning, without adding complexity or disrupting workflows. Achieving this smooth integration demands engagement from clinicians, thoughtful system design, and ongoing adoption based on users' feedback. Assessing the evaluation and effectiveness of CDSS is essential to understanding their true impact on healthcare delivery. This involves measuring their ability to enhance clinical outcomes, such as reducing medication errors, preventing adverse events, and improving adherence to evidence based practices. Effectiveness is often gauged by how well CDSS influence clinicians' behavior, patient safety, and overall workflow efficiency. Studies are conducted to evaluate how system alerts are received, whether they are relevant and correctly timed, and how clinicians respond to them. The ultimate goal is to ensure that CDSs serve as reliable, trustworthy tools that contribute meaningfully to better patient outcomes. Continuous evaluation and system refinement are critical for maintaining effectiveness, especially as clinical guidelines evolve and new challenges emerge in patient care. Despite the promising benefits, barriers to adoption and use are significant hurdles that many healthcare organizations face when trying to implement CDSS on a broad scale. Technical challenges such as lack of interoperability between various electronic health record system and decision support tools can limit functionality and usability. Clinicians often express skepticism or resistance, especially when alerts are perceived as irrelevant or disruptive, leading to alert fatigue, a phenomenon where critical warnings are ignored due to excessive notifications. Financial constraints are another obstacle, as initial costs for system deployment, customization, and ongoing maintenance can be prohibitive for smaller institutions. Organizational culture, workflow disruption, and the need for continuous staff training also influence adoption rates. Overcoming these barriers require a combination of thoughtful system design, stakeholder engagement, education, and policy support to promote trust, usability, and continuous improvement. In conclusion, clinical decision support systems exemplify how innovative health informatics solutions can vastly improve the safety, quality, and efficiency of healthcare. Their purpose is to enhance clinicians' decision making through timely, relevant information. Their diversity allows adoption to multiple clinical contexts and integration into workflows ensures usability and acceptance. Ongoing evaluation guarantees sustained benefits, and addressing barriers is vital for widespread adoption. Mastery of these topics is essential for anyone involved in modern healthcare, as the CDSs are shaping the future towards a smarter, safer, and more patient centered care. Next, Module 6, Public Health Informatics. As the digital transformation of medicine accelerates, the importance of harnessing information technology to promote health at community, national, and global levels has become evident. The vital components of this discipline is public health informatics, a specialized area focusing on the application of information technology to improve population health. This module begins by examining the role in disease surveillance and monitoring, where health informatics tools enable real time tracking of disease outbreaks, vaccination coverage, and health trends across populations. By integrating data from various sources, public health professionals can promptly identify emerging threats, monitor control efforts, effectiveness, and support evidence based policy decisions. The ability to rapidly detect, analyze, and respond to disease patterns using advanced informatics systems is critical in safeguarding public health. The next focus is on data collection and reporting systems, which serve as the backbone of effective public health initiatives. These systems gather information from hospitals, clinics, laboratories, and community health programs, transforming diverse streams into meaningful data sets. Efficient data collection and reporting facilitate timely decision making, resource allocation, and public health interventions. This part of the module highlights how standardized data collection practices, integrated reporting tools, and digital surveillance platforms enhance the capability of health authorities to respond proactively to threats, track progress, and evaluate interventions at multiple levels. Accurate, complete, and timely data are fundamental to effective public health strategies, and informatics solutions are key in achieving this aim. Informatics in emergency and disaster response is another crucial aspect of public health informatics. During emergencies such as disease outbreak, natural disasters, or mass casualty events, rapid data sharing and real time communication are vital. Informatics systems facilitate coordinated efforts by providing centralized, accessible information repositories, enabling effective resource deployment and supporting communication among responders. Technologies such as GIS, also referred to as Geographic Information Systems, mobile reporting tools, and emergency alert systems help public health agencies coordinate responses efficiently, monitor evolving situations, and deliver timely aid. Learning how informatics support these high stakes scenarios prepares students to contribute to preparedness and resilience initiatives in real world crisis. This module will conclude with cases or the case studies of public health initiatives that illustrate successful application of health informatics in real world scenarios. These case studies provide insights into how different countries and organizations have leveraged data systems for vaccination campaigns, disease eradication efforts, health promotion programs, and rapid response to outbreaks. Analyzing these examples helps the students understand best practices, challenges faced, and innovative solutions developed to address public health challenges using informatics. These stories of success inspire and guide future efforts to employ technology in advancing community health initiatives globally. Through this exploration of public health informatics, students will grasp the profound impact that data and technology have in monitoring health trends, shaping policies, responding to crisis, and ultimately saving lives. Mastery of these principles is essential for shaping healthier communities and ensuring that public health systems are resilient, agile, and equipped to face current and future challenges. Next, Module 7, Ethical and Legal Issues. As healthcare systems worldwide undergo a rapid digital transformation, understanding the ethical and legal frameworks surrounding health data becomes increasingly important. This course aims to provide students, clinicians, technologists, policymakers, and administrators with foundational knowledge on how to ethically and legally manage health information, ensuring that technological advancements serve the best interests of patients and society at large. A critical module within this discipline is ethical and legal issues in health informatics. This area addresses the complex considerations that arise from collection, storage, sharing, and use of health data. As digital health records, telemedicine, and data analytics become more prevalent, questioning about privacy, consent, and ownership of health information come to the forefront. The module starts with an in-depth discussion on patient privacy and data confidentiality, emphasizing the importance of protecting individuals' sensitive health information from unauthorized access. In a landscape where breaches and misuse of data pose significant risks, understanding how to implement protective measures such as encryption, access controls, and anonymization is critical for maintaining patient trust and complying with regulations. The conversation then shifts to informed consent and data use policy, which underscores the importance of transparency and patient autonomy. Patients have a right to know how their health data will be collected, stored, and used, especially as data sharing between providers, researchers, and third parties become more common. Informed consent is not just a legal requirement, but an ethical imperative that ensures patients retain control over their personal health information. Clear, accessible policies help build trust and empower patients to make informed decisions about their health data. In light of increasing sharing of health data across organizations and borders, ethical challenges of data sharing have become a pressing concern. While sharing information can lead to better clinical outcomes, research breakthroughs, and public health benefits, it also raises questions about ownership, consent, and the risk of data misuse. Balancing the potential benefits of data sharing against the risks related to privacy violations and ethical misappropriation is a nuanced challenge. This part of the module explores the moral responsibilities of healthcare providers and organizations to protect patient rights while fostering innovative uses of health data that can benefit society. Finally, ensuring legal compliance and data governance forms a vital part of responsible data management. Healthcare providers and organizations must navigate an intricate web of local, national, and international laws that regulate health information. Laws such as HIPAA in the US, GDPR in Europe, and various other regional regulations set the standards for data privacy, security, breach notification, and cross border data transfers. This segment discusses the importance of establishing robust data governance frameworks that ensure compliance, outline roles and responsibilities, and set policies for data stewardship. Proper governance not only minimizes legal risks but also promotes ethical stewardship of health data, reinforcing patient trust and organizational integrity. Through this module, students will develop a comprehensive understanding of the ethical and legal considerations essential to responsible health informatics practice. They will learn how to balance innovation with respect for individual rights and how to develop policies that protect patient privacy while enabling the potential benefits of digital health. Mastery of these principles is fundamental for fostering trust, ensuring compliance, and advancing ethical standards in the rapidly evolving world of health information technology. Next, Module 8, Future Trends and Innovations. As the healthcare landscape is continually transformed by technological breakthroughs, understanding future trends and innovations becomes crucial for anyone involved in healthcare delivery, management, or policy making. This course provides a comprehensive overview that prepares students to engage with, adapts to, and lead change in this dynamic environment. One of the core themes of this course is examining the impact of artificial intelligence and machine learning on healthcare. These advanced technologies are redefining diagnostic processes, clinical workflows, and research methodologies. AI powered algorithms are increasingly capable of interpreting complex medical data, assisting clinicians in making more accurate diagnosis, predicting patient risks, and personalizing treatment plans. Machine learning models analyze large data sets to identify patterns and insights that were previously unreachable, enabling proactive interventions and developing predictive tools that improve care quality. This revolution in data processing is leading towards smarter, more efficient healthcare systems where AI acts as an intelligent partner in decision making. In tandem with AI and ML, personalized and precision medicine are emerging as transformative paradigms. Moving away from a one size fits all approach, these innovations leverage genetic, environmental, and lifestyle data to tailor treatments to individual patients. The integration of genomics, proteomics, and other biomarker data into clinical practice allows for highly targeted therapies that increase efficacy and reduce adverse effects. This shift is driven by advances in sequencing technologies data analytics, and bioinformatics, making it possible to customize health interventions on a per patient basis. As a result, healthcare is becoming more precise, patient centered, and effective, with treatments designed specifically for each individual's unique biological profile. Further, the landscape of telehealth and mobile health is experiencing exponential growth. The COVID 19 pandemic accelerated the adoption of remote care solutions, demonstrating their importance for maintaining healthcare access during crisis. Advancements in telehealth now include not only virtual consultations but also remote monitoring, remote diagnostics, and digital therapeutics. These technologies help overcome geographic barriers, improve patient engagement, and optimize healthcare resource utilization. Mobile health solutions such as wearable devices, smartphone apps, and sensors enable continuous health tracking outside clinical settings, fostering proactive health management. As these technologies evolve, they will increasingly integrate with existing healthcare systems, making remote, personalized, and real time health interventions accessible to broader populations. The horizon of health informatics is also being shaped by emerging technologies and future opportunities. Innovations such as blockchain for secure data sharing, augmented reality, also referred to as AR, and virtual reality, also referred to as VR, for medical training and patient education, and Internet of Things, also referred to as IoT devices, for comprehensive health monitoring, are opening new frontiers. Researchers and companies are exploring ways to harness these tools for improved diagnostics, treatment, and health system management. The future will also see greater integrations of wearable sensors, smart environments, and bioinformatics, creating interconnected ecosystem that enable continuous and real-time health insights for both individual and population levels. These advancements offer extraordinary opportunities for improving health outcomes, reducing costs, and advancing global health equity. Through this forward looking module, students will gain not only awareness of upcoming trends, but also insights into how these innovations can be harnessed responsibly and ethically to create smarter, more efficient, and more equitable healthcare systems. By understanding these future opportunities, learners will be better prepared to lead and innovate in the world where digital health is becoming increasingly central to medicine. Mastery of emerging trends will empower future health informaticians, clinicians, and leaders to shape the healthcare environment that is personalized, precise, and technologically advanced for generations to come. Thank you.